This is Dr. Kamala Tamirisa, one of the cardiac electrophysiologists with Texas Cardiac Arrhythmia in Dallas. We'll just talk about cardioversion, the role of cardioversion anytime if there is a pregnant woman with unstable SVT, which is sustained hemodynamically. Recently, I had a patient who was at 28 weeks gestation and came in at the SVT at a rate of 290 beats a minute with a systolic pressure of 60. She didn't respond to adenosine. She didn't respond to 2 doses of adenosine. Beta blockers obviously could not be given because mom was hypotensive. So in that case, acute cardioversion is warranted, just like a non-pregnant woman, no reason to withhold cardioversion. The energy that can be used safely is 50 to 400 joules as much needed without fetal adverse rates. And the success rate during pregnancy, acute termination, is just like a non-pregnant woman, more than 90%. So it's a safe maneuver. Couple of just take-home points with regards to cardioversion. Cardioversion does not compromise fetal blood flow. There's some reports of uterine contraction. Usually I try to educate myself and my team saying if she complains of some contractions post-cardioversion, it's okay, just a lot of hydration, go ahead and feed her, reassure the patient. For the most part, they do fine. While cardioversion is very safe, it's prudent to do it in a place where there's fetal monitoring, if time allows, obviously if time allows, fetal monitoring and emergency C-section and our MFM and high-risk OB are just at least notified. And a couple of things, placing the patch placement, that's important, right? Where do you put the patches for cardioversion when you're dealing with a patient with SVT? We're not trying to shock a VT patient, so the patch placement is anterior and the posterior, unlike the anterior and the lateral positions. So that's important. And the key point is the gravid uterus needs to be avoided. Otherwise, all the energy is not delivered to the maternal heart. Amniotic fluid is a good conductor, so it's very important to keep the patches away from the gravid uterus and have fetal monitoring during that time.